So good morning, welcome to Follicle Fix at 6, your daily dose of hair wisdom served fresh at sunrise. It's sunrise time in India, and if you're in other parts of the world, your time would be different. But this is the time that I choose when maximum patients of mine, maximum subscribers of mine are available across the globe in Australian continent, in North America, and in India are available to listen to this talk in the morning. So I am Dr. Tejinder Bhatti. For those who have joined the first time, I'm a plastic surgeon dedicated exclusively to surgical hair restoration, and I have my clinics in Chandigarh, Mumbai and Amritsar, and I operate only in one clinic at a time. So each morning at 6 o'clock, I meet you here not as a salesman, not as a salesman of hope, but as a custodian of truth in a world, in a hair transplant world flooded with follicular fantasies and half-baked promises. So this live stream is where science meets sincerity. Here we decode myths, clarify doubts, and lay bare the realities of hair loss. Hair loss treatments, hair loss options for both men and women, and surgical advances without any jargon, without any gimmicks. Because in this age of influencers and algorithms, truth is the rarest serum you can apply to your scalp. Whether you're considering finasteride, wondering if PRP is worth the pinch, whether you are considering which hair transplant procedure to undertake, whether you want to know what part of the procedure is to be done by the doctor, you've come to the right place. And think of this morning session as your morning walk through the garden of follicular facts, not follicular fiction. And in today's episode, I'm going to discuss about the various steps of a hair transplant procedure, the step-by-step approach to hair transplant surgery. But because what happens in the hair transplant surgery, in the theater, very few people have any idea of before they sign up for a hair transplant procedure. So grab your coffee and let us demystify the hair transplant procedures step by step. So hair transplant, as you all know, is a meticulous surgical procedure. It's not a salon procedure like many patients think it to be. It's a surgical procedure, a meticulous one at that demands a confluence of artistic vision, anatomical knowledge and surgical precision. The integrity of the procedure and consequently the patient satisfaction hinges upon the surgeon's direct involvement in the key stages of the hair transplant. And delegating these critical steps to non-physician personnel not only undermines the quality of the outcome, but also raises certain ethical and legal concerns. And in many countries like in India, the National Medical Council has drafted rules and regulations by which it has been made amply clear who can do the procedure and who cannot do the procedure. In spite of this, many clinics are using non-medical staff, even staff which is not even with a nursing background, to do the procedure, to do the entire procedure, and these clinics do more than one procedures in a day. Some clinics even boast of doing 10 and 15 procedures a day, and I don't see any merit in why they boast that they do 10 procedures in a day, because patients today are quite well researched and they know that if there is a quantity being done in a clinic, quality will take a beating. So we come to the pre-operative consultation and the hairline design. So the hair transplant journey begins with a comprehensive, in-depth consultation which first happens online. The person sends his pictures and you send as a doctor your assessment of his hair loss condition, his hair baldness pattern, and you tell the person whether he is fit for a hair transplant procedure or is not fit for a hair transplant procedure. This only the doctor can make a plan for the patient, because every plan is individualized. There is no one plan which fits all. So the doctor assesses the patient's scalp, discusses his expectations later in a video call, and formulates a tailored surgical plan. Many times patients, after the initial consultation, sending pictures and getting an assessment, they would like to visit. I'm aware of the fact that people who are staying abroad cannot make that visit because it involves money. Nothing less than say $2,000 if you're traveling from USA. Return ticket will be costing that much. But technology has made it possible for us to do consultations online. Yes, it has a few fallacies, but they have to be covered during the consultation, thinking that sometimes I ask my patients to take an opinion from a local doctor who's well reputed and then get back to me. So this way we can figure out to a great extent whether the patient is fit for a procedure or not, and we come to know exact details about the patient's donor area, his baldness, his skin condition, and then the patient goes on a live call with me in which we determine his objectives and we tone down his irrational expectations if he has those, and we work out a plan of his hair transplant and hair loss treatment. Many times patient is required to be taking a hair loss treatment before coming in for procedure, and these conditions are like diffuse pattern alopecia. Sometimes there is extensive miniaturization in the scalp, and many times there is some infection focuses in the scalp, and the patient might also have certain skin conditions like eczematous dermatitis or a lot of dandruff, a lot of flaking, and infections like boils, like pimples, which we need to be treated before he can be taken up for the procedure. So a preoperative consultation before you land up at Darlington's clinic in India is an absolute must. Otherwise you might just have to go back home. Take for example a patient who is diabetic. His HbA1c level is more than 6.5. He just cannot be done. He cannot be taken up for a procedure because we need sugar levels to be lower than 6.5 HbSAg1 prediction of the hyperglycemic levels. HbA1c levels. So consultation is an absolute must before landing up for a procedure. I know many countries you just land up and you get the procedure done, but then there are a lot of horror stories as well. Everybody is not a candidate for a hair transplant. To my clinic, out of every 10 patients who land up for a procedure or who seek consultation, only about 5 or 6 patients are eligible to be candidates at that moment of time for a hair transplant. 2 out of 10 patients are just not eligible for a hair transplant because they either do not have the requisite scalp donor, or it is not as good as would allow a hair transplant procedure done logically, even after treatment. But 2 out of 10 patients are those patients who have been initially refused the procedure, but after due diligence of taking medication judiciously under the supervision of the clinic, that is my clinic at Darlington's clinic, I do it myself, they are now candidates, and after 4 to 6 months have passed for a hair transplant procedure. So a preoperative consultation cannot ever be underrated. It is absolutely important if you are seeking a hair transplant which will give you optimal results and which will last for a long period of time, and you will not be wasting money, you will not be wasting your emotions and your energy and time, of course. The next important step is the hairline design. A hairline one grows into as you age, not grow out of. If you make a low hairline, as you age, that hairline is not going to recede. As normal people, if they have a low hairline, with age it goes back and gives them the appearance of a mature look. But if you cast your hairline, cast anchor at a lower level, that hairline is not going to move up at all. And if you have, God forbid, if you develop an extensive pattern of baldness, that pattern of baldness will not go with the low hairline that you got initially in your younger days. It will look so incongruent and fake that you would want to only shave off your head, and so that hair transplant is not worth its value. A hair transplant which has been shoddily planned, a hairline which has been given at a very low location, sometimes at mid scalp. You see so many horror stories on the internet, and you can find out for yourself how low hairlines look bad. They look like simian hairlines or hairlines of monkeys. The next step is local anesthesia. Administering local anesthesia is a critical medical procedure that necessitates a thorough understanding of scalp anatomy and pharmacology. Otherwise, the patient will continue to have pain throughout the procedure, and this affects the quality of the procedure and also the time in which the grafts go into the body. If the patient is going to continue to shriek with pain, and you continue to give patient anesthesia, the grafts are all out and patient is having pain because of improperly given anesthesia, it is going to delay the out of body time of the grafts which are outside already. So a very skillfully done anesthesia is an absolute must. The patient should be pain free throughout the duration of the procedure, that is 6 to 8 hours. One has to ensure patient comfort and patient safety, minimize the risk of complications like development of hematoma or nerve injury due to anesthesia, and adjust the anesthetic technique in real time based. It should be real time based and based on patient's response. Delegating this task, which is a proper medical task a doctor only should do, to non-physicians, which many people do, can compromise patient safety and is generally considered outside the scope of practice for technicians because it can be very risky. Whatever fatalities you have heard about hair transplant surgery have been less because of the procedure, more because of the anesthesia. Because anesthesia, if used in improper wrong hands without knowledge, can be lethal. And then we come on to the donor harvesting. The whole aim of donor harvesting from the scalp donor, from the beard donor, from the chest donor, and other sites if they have terminal hair, the whole idea is to extract follicle units in one piece, and to lower the transaction rate in harvesting. And this can be done by a steady hand, a skillful eye, a hand-eye coordination which is trained over several years. A high magnification is required because if you do not use high magnification, like many clinics, they will compensate high magnification by using a bigger size punch size so that they can harvest all the grafts in one piece. You can use, when you use magnification, you can use a smaller punch size and do the same thing without causing much trauma in the donor area and cause less scarring. So it is essential that the person who does your hair harvesting should be able to take out the grafts in one piece, number one, and number two, he should do minimal damage in the donor area. The punch he uses should be very minuscule, just appropriate enough to harvest the grafts which are being targeted. There should be a ratio of 1:5 of harvest, the golden ratio, which should be respected, because if you do not, the punch holes nearby will soon coalesce, because the bridge between the two punch holes will be so flimsy it breaks down because of lack of blood supply. They coalesce and they form big patchy scars which are visible from a mile and look so ugly. Moreover, if too much of harvesting is done, clinics boast of 4,000, 6,000. There's a European clinic which boasts of 12,000 grafts in one session from the scalp. This can cause severe shock loss in the scalp donor and make it not available for future sessions. So this is the doctor's job. Donor harvesting is the doctor's job. Selecting the appropriate donor sites to maintain aesthetic balance, utilizing proper techniques, choosing the right punches. This all minimizes scarring and preserves follicular integrity. And making intraoperative decisions based on tissue characteristics is a dynamic process, which is not mechanical. And given the complexity and potential of irreversible damage, this step, that is donor harvesting, should be performed by the surgeon himself, the surgeon for whom the person has come. He has put all his faith and book his procedure. So the surgeon should be doing all the harvesting. And then we come on to the next important step, which is slit making or recipient site creation. Creating recipient sites is a decisive factor in determining the direction, in determining the angulation and the density of hair growth. So the surgeon, it's his duty to analyze existing hair patterns, follow the natural flow of the hair, especially in the crown area and also in the front, customize slit orientation to achieve desired density, desired coverage, because if you're covering extensive baldness grade 5, grade 6, the surgeon has to know where to do the strategic placement. You cannot expect to cover the whole head with 5,500 grafts that you've harvested from the scalp of the bare donor. So you have to strategically take decisions in which placing grafts in some areas will give you more bang for the buck, and areas in the crown area or areas where there is existing hair can be treated more medically and give the patient a head full of hair look without compromising coverage, without compromising density, and without compromising the overall look. And also avoid damaging his existing native hair by use of magnification. Avoid making slits which are too deep, compromising the blood supply, which will affect the healing and also the regrowth of planted grafts. So this step is both technically demanding and artistically nuanced. It necessitates the surgeon's direct involvement to ensure a natural and harmonious result. And then we come on to graft preparation and implantation. A lot of stress has been given to graft implantation and graft preparation. I would say that the patient's interests are best served by giving more attention, more detailed focus should be on the recipient area, because it is not like you want to fill up the whole head, do future proofing. This is not going to serve the patient's long-term goals. The long-term goals of the patient will be served, because baldness is ever progressing. Long-term goals are going to be served by preserving the scalp donor. The scalp donor should live for enough, sufficiently, so that it can be harvested again. We can go back, tap the donor source as and when the baldness progresses, which will, if you are a young male with extensive history of baldness and visible thinning. So you cannot kill the goose that lays golden eggs in one go. You have to keep plan B ready. So you cannot harvest 8,000 grafts in one go and say that you're done and the patient is very happy, and after 2 years the patient comes back to you and you got no resource left to treat his further progression of baldness, because you've committed yourself by utilizing all the grafts in one place. So while dissection and implantation of grafts can be delegated to trained technicians, dissection meaning preparation of the grafts on the table once they're out, this should all be done under the surgeon's supervision. This is a non-surgical step, but at a very important step, and the surgeon should exercise responsibility for overseeing the quality control of graft preparation. He should ensure that implantation aligns with the pre-established design. He should address any intraoperative challenges that may arise from time to time. It is the doctor's, the surgeon's leadership and oversight and integrity that determines the outcome the patient is going to get after the hair transplant procedure. And of course, the post-operative care after the hair transplant procedure is as important. The doctor should have a role in following up on all the patient's doubts as he sends his pictures on WhatsApp or on email from time to time at the 1 month mark, 3 months mark, 6 months mark, 9 months mark, and 12 months mark. And the clinic should have a standard operating procedure and should provide detailed aftercare instructions and follow up from time to time. The doctor should monitor the healing and address complications if they do occur promptly, evaluate the long-term outcome and plan for any necessary revisions. It is the continued involvement of the doctor which reinforces patient trust and ensures continuity of care. So before I end this didactic conversation about the step-by-step guide to hair transplant, I conclude by saying that in the realm of hair transplantation, the surgeon's hands are not merely instruments but the embodiment of skill, of judgment and ethical responsibility. Delegating critical surgical steps to non-physicians not only jeopardizes the quality of the outcome but also contravenes the ethical standards and patient expectations. Upholding the sanctity of the surgeon's role is paramount in delivering results that are both aesthetically pleasing and medically sound. Thank you for that, and now we will come to the questions one by one. I have a list of questions that have been put by my subscribers, and those of you who are here, and almost 80% of the people who watch my live streams haven't subscribed yet. So please kindly, most kindly, please subscribe. Your encouragement keeps the channel going. If I have 25 to 50 subscribers from this talk, I will feel that my worth has been realized. The worth of this time that has take out 45 minutes, 35 minutes every morning has been realized. So first question is by Mr. Hari Prasad Jawaharlal. He's one of the most constant viewers of the live sessions. Hi doctor, happy to on Sunday morning with super energy flow. I have multiple questions. I'm convinced that oral minoxidil is a safe medication given my night shift job. I'm taking oral minoxidil finasteride daily at 1 a.m. IST. However, I'm struggling with insomnia, not getting proper sleep during my designated sleep time in the morning. So Mr. Hari Prasad Jawaharlal, yes, this could not be because of oral minoxidil, because oral minoxidil will not cause you insomnia to a great extent in the dosage that I have given to you. So you can get in touch with me separately. I will write down a medication for your sleeplessness, which you can start putting into your protocol and use it for about a week and then get back to me. So send me a WhatsApp on my number you already know, and we'll write down the medication which will be good for you, and you should be fine. Mr. Booms, can we take oral minoxidil and finasteride pills at the same time? Can it cancel out each other's efficacy when taken together? Not at all, Mr. Booms. Both the drugs have different mechanisms of action, and they are both recommended to be taken at night. Finasteride is recommended to be taken at night because the finasteride blood concentration should peak in the morning at around 7 to 8 o'clock. At the same time, when the DHT levels are at the highest, so that it can maximally suppress the DHT levels, and so that with lower dosages of finasteride we can have maximum gains. Minoxidil is advised at night because it lowers your blood pressure by 5 units. In the daytime, if this happens, you might feel a little dizzy and you might have loss of concentration in your work, and that's not a good thing. It is safe. 5 millimeters drop in blood pressure is not too much when you're taking 2.5 milligrams of minoxidil, but it can cause dizziness in some patients, so we advise it to be taken at night. Both of these drugs can be taken at night. They're not being given in a very high dosage, and they do not interact with one another. Please take them without fail. All my patients take them at night, and you should too, without any hesitation, without any doubt in your mind. So Mr. Jawaharlal says, should I consider changing my oral minoxidil intake to 6 a.m. in IST, which aligns with my sleep schedule? Yes, please do it, because your sleeping time is in the morning, so please take it at 6 a.m. In the morning, and then you can consider this, use this for 7 days, and then after that you can get in touch with me. If you still have insomnia, get in touch and I will advise you accordingly what sleep medication you should use. So your sleep timings are, you said, between 6 a.m. to 1 p.m. Yes, you can take it at just before going to bed at 6, take it at around 5:30, and you should be fine. Yeah, please do. You have asked these questions multiple times. So Mr. Trav wants to know, should we use conditioner along with Johnson baby shampoo? I wash my hair on alternate days. I am at 110-day mark after hair transplant now. You are at a 110-day mark. That is almost like 4 months, just short of 4 months from the hair transplant procedure. In my clinic, I advise Johnson baby shampoo, yes, which you are already using. You can use a hair conditioner by L'Oreal, Dove, whatever is good for you, once in a week or twice in a week, no problem. You can do it without any problem at all. But I hope you are applying the some oil on your head over the planted areas, which should be applied for 6 weeks to 12 weeks after the hair transplant procedure. Mr. Phillyboy Fitness wants to know, do you ever prescribe dutastride 2.5 milligram for people? 2.5 milligram, Mr. Phillyboy Fitness, is a very, very large dosage. I mean, 0.5 milligram is enough in most cases, and I do not think that there is any merit in increasing the dosage any further, because if you increase the dosage any further, you will get something called as reflex hyperandrogenicity, and I'm going to send you a link to reflex hyperandrogenicity just now. You must go through this because the receptors of the human body, follicle receptors, are not timid, they are not foolish, they upregulate, and this can happen because of several reasons, of which one is over medicating yourself. And I am sharing this video with you. Please go through this video and you will know what dangers you are experiencing if you take 2.5 milligram of dutastride or 5 milligram of finasteride dosage. I'll send you one more link. Reflex hyperandrogenicity. Please go through both these videos. Reflex hyperandrogenicity is a real problem in treatment of hair loss due to androgenic alopecia, and I will advise all my patients not to, without doctor's supervision, play around with dosages, because these dosages affect the hormonal milieu of your body, and it's not a good thing. Forever you would have lost the chance of getting a good result. How many grafts does it take to create a super dense beard? So Mr. Philly, it all depends upon the amount of hair that you already have on your cheeks, on your chin. A fully dense beard in a person who doesn't have any hair at all would require about 6,000, 7,000 hair. But when you commit all these hairs on your beard, you must be cocksure that you do not have any history of baldness. There is no progression of baldness on your head. And you have to choose which is important, having head on the hair or a beard. In males, the beard can always be shaved off, whereas having the head of hair is, I think, more important than having a full beard. And from our previous discussion, it seems that you also are suffering from androgenic alopecia. So I would advise you not to go on this path of addressing both your androgenic alopecia and your beard at the same time. So that is the question that I have answered, and I hope people have benefited from what we have discussed just now. If you have any other question, please ask. Otherwise, I'll go to the questions which have been asked by me from me on YouTube in the last couple of days. So this is a question, interesting question. If I am Norwood 4 by 25, should I plan to get it done in 26? Is it a good decision or should I wait? I am 21 and a half and definitely Norwood 3, but receding hairline covers well with longer front hair. See, this question cannot be answered just by this input that you've given me. I would like to know your family history of baldness. I would like to assess your scalp donor area, and also I would like to see what your objectives are from a hair transplant procedure. So you can send me a WhatsApp message and share with me your details that we will ask for when you send us the message on the listed WhatsApp numbers in the YouTube description video from which you have come to us, where you ask this question. And I will also reply back to you on that place, and you can get back to us. Sir, then what's the use of having hair when you are not younger but after you are older and married with kids? Yes, this is a valid question. That when you are young, you are being discouraged from doing a hair transplant, and when you become older, you have become an ideal candidate once you're married, ideal candidate for a hair transplant surgery. But let me tell you, as you age, hair is still a priority. I have had a person who was surprisingly 88 years old who came from Germany seeking a hair transplant surgery. See, he is not going to get married. He is not in the dating circle. He had come for a hair transplant basically because the image that stares at him from the mirror makes him shifty, it makes him uncomfortable. It's all about self-image and pleasing your own self. You will still, after young age, continue to have to want a head full of hair. Getting a hair transplant done at an early age, which you might repent, and you might look a museum piece if you get it when you're not a candidate for hair transplant, which is determined only at 25, has its own distinct problems, which are far more immense than having hair at an early age. I can assure you that getting a bad hair transplant which is done early, is a far worse thing than remaining bald at a young age. So you can send me your pictures and I'll reply back to you. Mr. Arman wants to know, I'm using minoxidil 2.5 milligrams a day for nearly 5 months. But till the 4th, I had no hair shedding, but after 5th month, my hair is shedding a lot. Is it normal to shed hair using oral minoxidil, or it seems like it doesn't work for me? See, Mr. Arman, you're likely not taking a DHT blocker. A minoxidil, whether taken orally or topically, only has a limitation of only causing thickness of the hair, increasing the anagen phase, till as long as the hair are there. It doesn't stop progression, which is the factor which is determined only by, which is controlled only by a DHT blocker like finasteride. So you should take a consultation by a doctor and ask him the real purpose for your having shedding. If it is progression of baldness, minoxidil, I'm sorry to say, will not be sufficient to control your shedding. Next question by Mr. Nitin Yadav. Doctor, does switching from non-alcohol based minoxidil to alcohol based start shedding? Non-alcohol based minoxidil is less potent than alcohol based minoxidil. Yes, anything that's stronger will cause shedding, but this shedding will last for 4 weeks, and after that it will all be fine. Mr. Dhanraj, he wants to know, hi Dr. Bhatti, from your videos I came to the conclusion that for less finasteride side effects you have to have a healthier lifestyle, and I'm just gonna start finasteride after stopping it after 1 month because of my sedentary lifestyle from studies, from 4 years of no physical activity and sitting, which has contributed to mild erectile dysfunction. But libido is there, and you also mentioned almost 40% people have ED and don't even know it. And I was also a consumer of adult content too. I have started gym and cardio and good diet. Just want to ask, what's the ideal blood work range for testosterone and E2? And should I take 0.5 milligram 3 times a week or 1 milligram 3 times a week? I'm currently on 1 milligram a day. Current report is age is 20 years, hair loss grade Norwood 2, BMI 20, medication minoxidil 5% with vitamin D 60,000 international units. Your response will be appreciated. So Mr. Dhanraj, you are 20 years of age. Generally, I do not advise patients to go on finasteride till they are 21 because development is still taking place. So once you are 21, you can start with getting total testosterone level done, total and estradiol E2 level done, and send me the reports. Once these reports have come to me, and I will see which dosage is best for you, and I'll try to put you on the minimum dosage with results and follow you up. Yes, please reduce your weight. But BMI seems to be normal. So get into physical activity, lead an active lifestyle, take good diet, live a healthy lifestyle. Go to the gym, do cardio, but restrain from doing too much of exercises like weight training, too much of powerlifting, anaerobic exercises, and definitely do not take whey protein, and you should be fine. Rest of the treatments are fine, nothing to mention about those treatments. Can we continue to take whey protein after 3 months of hair transplant? I would not advise you to take whey protein till 6 months are over. Another question. Hello, thank you so much for your content. I unfortunately missed the live session. My question would be, when can I resume riding my bike after a hair transplant? Bike riding in terms of performance sports and always wearing a helmet. I think the helmet might be the most problematic factor. Not going for high intensity intervals most of the time means long distance easy endurance rides, which could be 5 to 7 hours long. High intensity rides are between 1.5 to 3 hours. Is there anything in particular which I should take a little bit more care of, like normally? Disinfection spray on the helmet after riding, for example. I'm very interested to know what your suggestion to resume and increase intensity and time with helmet on bike in regard to optimal recovery after hair transplant. So you have after hair transplant, you can wear a helmet after 6 weeks of the procedure. Please do not wear the helmet before 6 weeks. You can do biking by wearing a hat or a bandana, no problem at all. As far as biking is considered, it's not considered an anaerobic exercise. It is an aerobic exercise and a healthy exercise. Yes, before wearing the bandana, please disinfect your scalp and the headgear, and you should be fine. So those are the questions that people have asked me, and if there are still any questions that you may want to ask right now in this live session, please let me know. Mr. Sahil Das is here and he wants to know, so 6 times a week dutasteride is okay, or should I take it 3 times a week? Please refer to the link above, reflex hyperandrogenicity. This dosage is too much. I never prescribe dutasteride on a daily basis or even alternate days. At the most, it should be taken only once a week on Saturdays and no more than that, because you risk your hair loss becoming unresponsive to DHT blockers. Can 6,000 grafts fill up vertex, mid-scalp and hairline for diffuse thinning? Yes, this should be good enough, provided in diffuse thinning you can find those many grafts in your scalp. Mr. Philly Boy Fitness wants to know, do you create a male hairline the same as female hairline? Not at all. Female hairline is heart-shaped, whereas male hairline has a gradual M shape with a slight recession in the temple points, which is a distinctive sign for male hairlines, male face. But there are a lot of people who are becoming changing their sexual profile, and they come seeking a female hairline. In those cases, we have a certain set protocol in place, and we give it to them, males with female hairline. I was having a bit testicle pain while taking dutasteride, but it went away. Should I continue the medication? Yes, when you're taking dutasteride or finasteride, initially for the first 7 days to even 2 weeks, 3 weeks, you might have a little bit of testicular pain as the body adjusts to changed hormonal environment, and you generally get over it. Does anyone live until 75 years old and have the same density they have as a kid? Yes, there are many people who have same density, who are not influenced by DHT or male pattern baldness, but they are not so many, but there's a large number. I used topical 5% for 1 month and shifted to 5 mg oral recently, and tapering off the topical with once every other day use. Will this cause a shedding problem, and is oral minoxidil more potent? Of course, oral minoxidil is much more potent than topical, and whenever you switch to a medication which is less potent or more potent, please expect shedding to happen. Mr. Hari wants to know, will changing to 6 AM changes in the timeline again? Will I experience shedding again? Thanks. Not much, but there will be shedding. I find his voice advice more convincing and satisfying to listen to, which is why I prefer watching him on YouTube over WhatsApp. I'm organically promoting my hair improvement progress to my friends. Very good, very good. Thank you so much for your encouragement. Do people say you look 21? I didn't get this, Mr. Philippa Fitness. What do you mean by this? Do people say you look 21? Mr. Hari wants to know, and family, so they can benefit as well, and ocean of your knowledge. Thank you so much. I am really indebted and really honored by your comment. Really humbled. Mr. Sahil Das wants to know, sir, I was taking finasteride, but it gave me sides, but shift to dutasteride 6 times a week, or should I consult a doctor? It's been 3 months. See, if finasteride gives you side effects because of blocking 63% DHT, dutasteride, which blocks 93%, will definitely give you much more side effects. And you are taking much more dutasteride than logically one can take. And you risk reflex hyperandrogenicity, which is not a good thing. How long should I use Johnson Baby after shampooing after hair transplant? Mr. Trav, you can use it for 6 months, after which you get in touch with your hair transplant doctor. You're not my client, but every doctor, every clinic has its own set protocol. Please get in touch with them and they'll be able to help you better because they know your exact condition. I might not. But in my patients, they take it for 6 months, after which they switch to protein-based shampoos which cause more volume to occur, so that it can make their result more appealing. Philly Boy Fitness wants to know, do most Indians have a lot of hair loss? Yes, 62% Indians have some grade of baldness or the other, which is a large number, and the same as in the world community, 65% average. Okay, sir, I will soon continue an appointment with you soon, Mr. Sahil Das says. Okay, you're most welcome, Mr. Sahil Das. Does a young boy have the same hairline as a female? Yes. When you are you are not yet reaching your adolescence, before 16, 18 years of age, before the male hormones start to have their start to show their presence, female and male hairlines many times are indistinguishable. Both of them appear heart shaped. That is true. So that brings us to the end of the session. If you have any further questions, you can leave them on my in this video itself, which I will be putting on the YouTube channel, and we can take it on from there. Thank you for watching. Have a nice day and God bless you.